Ready to go? Okay, he's ready to go.
Good morning, everyone. I want to thank everybody for being here. I know this is kind of short notice, but we felt very strongly about doing this. I want to thank the library for being such a gracious host, and they're closed today, as everybody's aware of, but they were kind enough to open up and be the host for this. My name is Mike Wilder, and I'm the Director of the Office of Emergency Management for Danville and Boyle County. On the recommendation of our Judge Executive, Howard Hunt, we felt it necessary and possibly very important to reach out to the media for some assistance in conveying information to the citizens of Boyle County, how the coronavirus does affect Boyle County. You know, we see a lot on TV, we see the president, we see the governor of the Commonwealth doing all this speaking about things that are going on nationally and statewide, but I have so many people that ask me that, you know, well, what are we doing in Boyle County? Well, that's what this briefing is about today. We have assembled here today probably the core group that is charged with dealing with the outbreak, dealing with the prevention, keeping from spreading, and also the treatment of this virus. We will be having those folks up to speak to you, telling you what their agency is doing. This briefing is going to be streamed live on YouTube as well as Facebook Live, which hopefully the radio station is here, Hometown Radio is here, the Advocate Messenger certainly is here, and we're fortunate to have the Lexington TV markets here as well. So anybody that needs to get information, they should be able to do that after this briefing is completed. I do want to make note that as of today, as of this morning, we do not, and I repeat that, we do not have an active case of the virus in Boyle County. Ongoing testing is occurring, of course, but as of this date right now, we do not have an active case. And I want people to know that. Again, the Emergency Operations Center in Boyle County will be activated. It will be in the basement of City Hall next to our 911 dispatch center. It will be manned when the situation does warrant it to be open. We are communicating on a daily basis with city and county government, meetings, calls, all of those things to kind of let you know what's going on. But what I'd like to do right now is to turn the program over to Judge Howard Hunt, our Judge Executive for Boyle County, who will make some opening remarks.
Thank you, Mike. I've asked for this press conference to address all the concerns of the residents of Boyle County in every regard as it relates to this particular incident of the coronavirus or COVID-19. I have some information that I want the people of this great county to know about and know about from me firsthand. As your county judge executive, it's important that each resident of this county know that I spent 34 years in the military, and I have responded through my time in the National Guard to over 20 statewide disasters and emergencies. I'll say this for the purpose of helping ease your concerns about your county leadership. We know what we're doing. We're fighting an enemy that we've never fought before with a virus. It's usually a tornado or a flood or an ice storm. But this time it's a disease. Under the Federal Response Framework, which used to be called the Federal Response Plan, there's an emergency support function number 8. It's public health and medical services, medical assistance. And that is what we're operating under as we move forward. The rest of the story is you in Boyle County, in my personal opinion, are very fortunate to have people like Mike Wilder, our emergency management director, Brent Blevins, our health department director. There's so many in this county that have a vast experience in this arena that you can rest assured that along with them and several others in this county, that we are listening to the heartbeat of this incident as it goes on daily. We're on conference calls. We're getting email downloads. We're getting links online from the federal and state government in a very fluid situation. Please go to boyleky.com for your information. It's the Boyle County website. I'm asking our IT director, Mr. Bill Nichols, to constantly update it with information that's coming from the Center for Disease Control, where you can learn what to do in your workplace, what to do at home. And recently, just as of yesterday, there was a president's coronavirus guidelines for America, and he put out 15 days to slow the spread. It's on our website. Go there. What will be on there later today, after this news conference, are all the actions taken by our Governor Beshear, Andy Beshear, in helping mitigate the coronavirus's impact on the residents of the Commonwealth. The executive orders, those things are all there also. So rest assured, Boyle Countyans, that we are engaged, we are at the helm, attentive to the details that are necessary for the best protection of all of Boyle County, and we will continually update you so you can be as safe as possible. One thing that I felt very strongly about, I want you to know about, is we've come up with a number in working with our partner, the city of Danville, an 859, write this down please, 859-936-6865 number that residents can call with concerns, questions, whatever. But be advised that this 936-6865 number locally is not 911. It is not an emergency call number. Please, if you have a suspected emergency, call 911. If you have a question or a concern, there will be somebody that will answer that phone and get back to you or talk to you at the moment. There's other info that I think is very important, that there are fake opportunities out there online, and if some of these fake opportunities have malware attached to it, then it can hurt your electronic and computer systems. Be very cautious in what you go to online. You can get real information about those potential attacks at info. You can get information at hc3@hhs.gov. That's Health and Human Services, hhs.gov. I want to let you know, historically in Kentucky, there's a patient zero. That's where it started. Patient zero was in Harrison County. And I don't know when it was initially contacted, but it's online, you can find out. But that patient zero has now been tested twice, negatively, and is back engaged in those processes and normalcy of life. So that's important. And this whole thing has grown from basically January 30th to right now. So patient zero, and what is that, 6-7 weeks? Patient zero has now been cleared negatively twice and is back in their normal life. There is been an outreach by our congressional delegations from Senator McConnell's office, from Senator Rand Paul's office, and from Congressman Brett Guthrie's office. They are all offering support in anything we need to do to be successful to protect Boyle County's. And all we got to do is reach out and let them know what our needs are. I am extremely pleased with the partnership that we have worked with the city of Danville on, and also that has been extended to Junction City and Mitchellsburg and Parksville and Perryville and Forkland, to be able to cover all the residents of Boyle County with information that can help us be safe wherever we are. Recently, the Heart of Kentucky United Way reached out. Executive Director Dr. Stephanie Blevins reached out and offered assistance any way we could. And you can maybe get some assistance by calling 211, which goes right direct to the United Way, and they can help you with the increasing information as we grow in this process, and with the potential of assistance. We're in this. We're going to win this, and it's not going to last forever. The biggest thing you can do right now is to socially distance yourself from people, cover your cough. If you're sick, stay home. If you know people that are sick, have them stay home. Let's look out for our neighbors. We in Boyle County are all about that. Let's take care of those and offer, advice or counsel to those who may not have the internet, but help them stay safe and be protected. I want to thank you all for the attention to this detail. We have an excellent team, a core group that is involved in this event. And I want to close by saying how honored I am to serve as your county judge executive and serve with many of your county employees like Mike Wilder and Trilly Bottom and Courtney Shoemaker and many, many others. The jail is on lockdown, and we don't have the crews going out on the roads. Our courthouse is going to be restricting public access, and I'm going to ask Ms. Trilly Bottom, our county clerk, to come up and address some of that. If you need assistance out at the detention center, please contact our jailer, Brian Wofford, for that information, and rest assured that every Department of Corrections protocol is being adhered to the nth degree out there as far as hygiene and cleanliness and stuff. Our Boyle County PVA office will fall under the same guidelines as the county clerk's office, and you can get assistance through the PVA by calling 859-238-1104 or go to Boyle, B-O-Y-L-E, PVA.com, and you will be able to get almost virtual any assistance you could in person. The gathering place, it's important that our senior citizens not be forgotten. The gathering place, the senior activity center and adult daycare, has suspended all on-site programming until March 30th. Adult daycare services suspended to March 30th. Transportation assistance is being performed on a limited basis, and home-delivered meals will continue uninterrupted. A drive-through is being established at the gathering place for a meal pickup service, which will begin Monday, March 23rd. And any senior citizen 60 or above may come to the center between 11 and 1, and a meal will be delivered curbside. Only a limited number of meals will be available daily and will be distributed on a first-come, first-served basis. A limit of 1 meal per person per day will be imposed. They also have a Facebook page and a website, agatheringplace.org, and their phone number for information is 859-236-2070. I would like to introduce Trilly Bottom, and she's going to read a governor's executive order, and then I have one last statement I'd like to make in closing my portion.
Thank you, Judge Hunt. I'm Trilly Bottom, Boyle County Clerk. I received a memo yesterday from the Office of the Governor regarding the cancellation of in-person government services to the public. After much discussion and conversations with Judge Hunt and EMA Director Mike Wilder, we have decided regretfully to cease providing in-house government services to the Boyle County public. Beginning at 5 p.m. today, March 17th, we will be closed until March 31st. At that time, we will reassess and decide what options we have, if we should reopen or if we should remain closed at that time. What this means is we will be providing limited services. So even though our office is closed, our employees will be coming into the office. We will be doing web renewals. We will be working our mail, doing renewals by mail. We will be doing marriage licenses by appointment only. If there's anything that is an emergency situation, you can contact our office at 859-238-1110 or 859-238-1112. You can also contact me at my direct line at 859-238-1113. And we will try our best to provide the services that we can. We want to work with the public, and I know this is a huge inconvenience for a lot of citizens in our county. And it's also an inconvenience for us as well, not being able to process things that we would normally be able to do in a timely manner. But we will continue to work through this. We will get through it, and more information will be coming on the Boyle County website at boyleky.com and also Facebook page Boyle County Clerk. Thank you.
Thank you, Trilly. I'd like to ask now just for some brief comments from our Circuit Court Clerk, Ms. Courtney Shoemaker, and she will address those administrative office of court issues and stuff. Just Courtney, please.
Thank you, Judge. As Judge Hunt said, I'm Courtney Shoemaker, the Boyle County Circuit Court Clerk, and I'll just discuss briefly how we're handling court matters here in Boyle County. While the courts remain open at this time, the Chief Justice has issued an order restricting court proceedings from March 16th through April the 10th. Additionally, the Chief Justice of the Supreme Court has restricted entry of high-risk individuals into court facilities. Therefore, I would strongly recommend people call the appropriate office before coming to the courthouse. The entire Supreme Court order and updated information can be found on the Kentucky Supreme Court website under COVID-19 and the courts. With the exception of emergency and necessary matters, all civil and criminal dockets will be rescheduled. Court notices rescheduling cases will be sent to all parties at the last known address. Therefore, it's important that we have current address information for all parties. Judges have been encouraged to use telephonic or video technology as much as possible, and we're actually conducting circuit court by video as I speak. Courtroom attendance will be strictly limited to attorneys, parties, and only necessary witnesses. If anyone has questions regarding an upcoming court matter, they should contact their attorney. Those who are not represented by an attorney may contact the district clerk's office at 859-239-7362 or the circuit court clerk's office at 859-239-7442. The Kentucky State Police suspended all driver testing, so they will not be conducting written or road testing for the next 3 weeks. Yesterday, Governor Beshear issued an order that extends the expiration date for driver's licenses for 90 days. What that means is someone who has a driver's license that's nearing expiration has an additional 90 days to renew. And I would ask citizens to take advantage of that time frame and not come in unless it's absolutely necessary. Any questions related to the issuance of driver's licenses can be directed to the office at 859-239-7456. As you all know, this is a very dynamic situation, and I appreciate your patience during this time. Thank you.
Thank you, Courtney. I want to reiterate that Boyle County is ready. We're on point. We're paying attention, and the residents of Boyle County will have information as we have it from the federal and state government to best protect you. I want to close by saying that I appreciate the partnership with the city of Danville in particular. They helped us with the phone number. They helped us with the interpretation for the deaf. And I want to close by saying that fiscal court will restrict public access during our court meetings, scheduled court meetings, until further notice, in order to minimize the possibility of contamination to anybody in our very small confined space, which most residents know in the courthouse. So until further notice, we will suspend public participation during fiscal court sessions. Please, if you are inclined, pray as you may for the protection and healing of all residents, not only in Boyle County, but across this Commonwealth and across this nation. Prayer works. It's important. I will now introduce Director Wilder again. Thank you for this time.
Thank you, Judge. Moving right along, we have representatives, the mayor is here, as well as our new city manager, David McCron, and if he would come up and make a few comments, I think that would be very helpful to us.
Good morning. I'm David Milliron. I'm the city manager for the city of Danville. And I certainly want to thank the residents and the businesses of Danville and Boyle County. We're in uncharted territory. You've been patient. You've been understanding as we take actions together with the county, the state, and the federal government for your public safety. At the end of the day, these efforts are for that, public safety, to make sure that you and your loved ones are safe. With that said, Mayor Parrish and the Board of Commissioners met this morning and took actions in order, out of an abundance of caution, to prepare the city for making preparations and to maintain services for the Danville residents and to make sure that we are able to provide mutual aid assistance to the county and our partners. Out of abundance of caution, we want to make sure that first and foremost we protect public safety. These are our first responders, but as well it is our men and women who keep the city running on a day-to-day basis. We want to make sure that we enforce the social distancing, that we too will be operating on limited staff, but continue to operate and provide you city services such as clean, healthy water to drink, and more importantly, to wash your hands. Effective at noon today, City Hall will be closed to the public. No public will be able to access City Hall, and so therefore, again, we're in uncharted territory, but we can still conduct business with the public. That said, the city's phone number is 859-238-1200. Your calls will be answered, and we are there to help you. I'd also encourage you to go to danvilleky.gov, our website, where we'll continually put out information for the benefit of the public and in cooperation with the county. On that website are links to our online utility payments, where you can continue to do business with the city and make your utility payments. There is also a drop box in our parking lot for the purpose of making utility payments. We also aware that these are trying times, that some folks live paycheck to paycheck, and in a pandemic situation that some folks may be without work. So the city has taken some additional actions in that we are no longer turning off any utility for anyone just simply for failure of payment. Staff also for the last couple days has been out reconnecting all of those utilities for anyone that has been turned off. It is important that you understand the purpose of this is for public safety, and that one of the major preventions of the virus and the spread of virus is to vigorously and regularly wash your hands. All staff is focused on the emergency at hand. So under guidance of our council, all open records requests are suspended until further notice. We will be able to address those open records requests once the pandemic has subsided and that we're fully operational. Additionally, I've been in communication with John Bell. John is the director of the Danville Boyle County Parks and Recreation. And obviously, when the county and the city makes decisions, it has a trickle-down effect. So in this case, not only is the city closing City Hall to the public, but we're also closing all public facilities to the public. In doing so, those city facilities will be sanitized and cleaned and not reopen until we have a reversal of the current declaration. So I'm going to read a brief statement from Mr. Bell. It says, based on the recent actions taken by the city of Danville, Boyle County, and the local school districts, the Bunny Davis Center will be closed effective March 17, 2020 at noon until at least April 1st. In an effort to provide a safe and enjoyable experience, staff will be cleaning and sanitizing the facility during this closure. Be assured we will reopen as soon as possible. He would like to convey that baseball, softball, t-ball registration can still be done online. And that is at www.danvilleboylecoparks.com. They encourage you to go to their website and Facebook page for any additional updates and information. In closing city public facilities, know that our public spaces, our parks, are still open. We would encourage you to utilize those parks, but do so socially and responsibly by socially distancing yourself. With that, I want to certainly thank all of the cooperation we've gotten from Boyle County and Judge Executive and also Emergency Management. And with that, I'll hand it back over to Mike. Thank you.
Thanks, David. Moving along, we're going to ask now Brent Blevins, who is the director of the local Board of Health, and actually, according to our emergency operations plan, is the lead agency in this incident. Any time that we have anything to do with public health and human services, the health department pretty much is the lead. Brent is going to come up and he'll call on some folks to make some comments as well.
Hello all. I am Brent Blevins. I'm with the Boyle County Health Department. I'm the public health director here. First, I want to thank everybody for what they're doing in this community, coming together to work together. We are blessed here. We have a tremendous healthcare system in this county that a lot of counties do not, and we are truly blessed. So we thank them, and we'll continue to work with them as we go along. Before I make a few other remarks, there's a couple other agencies in the room that I would like to have the opportunity to come up and speak for a few minutes to make a statement. We will start with Center College, who obviously is a big part of our community, who we greatly appreciate here, but we would like to give them the opportunity to say a few words.
Great. Thank you, Brent. My name is Michael Stryzik. I'm Chief Communications Officer at Center College. Just a reminder, we are a campus community of about 1,800 people. We have 1,450 students and about 350 faculty and staff. On any given academic term, we have students abroad. We're known for a rigorous study abroad program, and this term we have about 100 students who have been abroad. Our students are in the process of returning home. That began Sunday afternoon. Our hope is that all who can make it home will do so by Tuesday, by today at 5 p.m. We will have a number of students who are not able to make it home that quickly, and we are working to be very flexible. We have a small international student population as well, about 8%, the majority of which come from China, and we are working closely with them to make sure that they are able to get home safely. We are understanding that a number of them will actually be staying with family and friends in the United States rather than returning home at this time. We've also been working closely with our students who are currently abroad, and that includes students in London, England, Strasbourg, France, Merida, Mexico, and then we have a handful of students that are in Glasgow, Scotland as well. The students from London have pretty much all made their way back. The students from Strasbourg have been having some difficulty. Delta has consolidated what are typically 3 flights into 1, but we hope to have them all back very soon. We are meeting, I will say, on a daily basis. We have a coronavirus task force that's been set up. It's comprised of our senior staff, and we've added a number of people to that to make sure that all offices and departments across the campus community are covered. We have a punch list every time we meet. This was from our meeting this morning. It's 3 pages long. We are trying to work through all of the things that are coming up. We have not closed the campus, but we are working to really restrict the activity. All performances at the Norton Center for the Arts have been canceled, for instance, and we are also working with our staff and faculty to make sure that they are able to work from home. Those staff in particular who may find themselves in a situation where they need to care for children, for loved ones, etc. We have set up a 2-week period initially that will allow them to be at home to deal with whatever situation they need, and that will not count against their vacation time, against their sick leave, etc. We'll be reviewing that, of course, as we're moving along. Our faculty are currently in the process of ramping up to provide a remote online learning experience. So we have extended our spring break. It will be this week, and then the regularly scheduled spring break next week. And then beginning Monday, March 30th, we'll begin a combination of synchronous and asynchronous remote online learning experience. It is our goal, because we offer a very personalized approach to education at Center College, that will be a very personal approach to remote learning as well. In the process, we've been very grateful for the support of Brent and his team. We remain in constant contact with them. I can say that we have 5 test kits at Center College. We have currently not needed to use any of them. We have had no reported cases of the flu since March 11th. And the activity at our Student Health Center yesterday was one of the lowest that we've seen in some time. That's in part because our campus community is pretty much emptying out at this point. But that's a really good sign. We are also going to make sure that we work to provide mental health care and counseling for all of our students while we're away. So we are trying to cover all the bases, but we have a good team in place, and we are grateful for the partnership here with Brent, with the city, and with the county. Thank you. Thanks, Brent.
Thank you for those remarks. Next, I'd like to call the representative from the Chamber of Commerce to come up and have a few moments.
Good morning, I'm Jody Lassiter, President and CEO of the Danville Boyle County Economic Development Partnership. And our partners include the Chamber of Commerce, the Convention and Visitors Bureau, the Heart of Danville Main Street Program, Main Street Perryville, the Boyle County Industrial Foundation, as well as the local governments of Boyle County and the cities of Danville, Junction City, and Perryville. Together, our development organization partners are providing assistance and information for local industries and businesses in response to the COVID-19 containment measures. We are facilitating networks for industries to communicate best practices to one another, and for small businesses like restaurants around the county to communicate with the public about their available services. For example, we are providing information and assistance for Small Business Administration economic injury disaster loans. We're participating in daily conference calls for area industry human resource managers organized by Eric Knoyer of Kimball National Office Furniture. We are hosting an email thread for our Industrial Management Council members to communicate info on their corporate and local policies. And we're using our social media channels to communicate info to the public about our businesses and industries. Our industries are implementing flexible PTO and unpaid time off policies to address potential staffing shortages as a result of sickness or the closure of schools and daycares in the area. They are restricting visitors and vendors to their facilities, including protocols to limit exposure of truck drivers to our local distribution centers. And we learned late yesterday that a large regional employer, Tartar Farm and Ranch Equipment in Casey County, will be closed for production as of today and reopen on April 6th. And that large regional employer does impact some Boyle County employees as well. Any business or industry that needs assistance or information can reach out to the Economic Development Partnership by calling us at 859-236-2361. Again, that is 859-236-2361. Or may email us at info@developdanville.com. info@developdanville.com. And now my partnership colleague, Jeff Jewell of the Chamber of Commerce, will share more about our small business activities and particularly local restaurants and food services.
Hello, thank you, Jody. I'm Jeff Jewell with the Boyle County Chamber of Commerce. I'd just like to let you know that we are reaching out with our partners at EDP to help all small businesses that we can. One of the small things we've done is we've started a restaurant guide online that will let you know which of our local restaurants are offering new delivery and curbside service. You can find that on DanvilleBoyleChamber.com. You can also find it on our partners' websites at Heart of Danville, Develop Danville, Main Street Parable, and Destination Danville. We'd just like to ask you at this time to please remember your local merchants. They're struggling. These people had to close their dining rooms. They're all trying to be as innovative and creative as possible, serve good food to our community that's safe for you to eat. So just when the dinners you'd normally eat at home, go pick them up at your restaurant, take them home anyway. They'll really appreciate you doing the takeout. I'd also like to let you know that we are in regular contact with the Kentucky State Chamber, the governor's office, both of our local senators and our congressmen to keep you abreast of everything we can to help the small businesses survive this and come out strong on the other side. And during and after this pandemic, the Chamber and all of our partners at EDP will be working with the community, the Small Business Administration, as Jody mentioned earlier, and many, many other resources to help make sure that you make it through this economically strong and come out maybe even better on the other side. We're also asking that you consider buying things mail order from local merchants. Many of them are getting new websites up and running right now. So thank you once again. Please support your local business community.
Thank you all. A couple of the agencies that we've saved to this point in the conference is to kind of lump our health people together. As I said before, we are truly blessed in this community to have health services. One of those is Ephraim and our EMS, along with a lot of other agencies. But we would like now to give both of them the opportunity to say a few words, kind of give us their direction, where they've been and where they're going, and to kind of help guide us along. So, Mike?
Thank you. Thank you, Brent. I just want to take a few minutes to talk about the preparations that we're making for a COVID-19 response to the virus. We're working closely with the hospital, Ephraim McDowell, with the Kentucky Department of Public Health, the Kentucky Board of EMS, our medical director, Dr. Grant, and Danville 911 Dispatch, and the Danville Fire Department. We are fully staffed at Boyle County EMS. We're ready to respond to patients with COVID-19 or any respiratory infections. Our goal is to evaluate the need for hospitalization and work closely with Ephraim McDowell to come up with the best treatment plan for the patient. If hospitalization is not medically necessary, and home care is preferable if the individual situation will allow. The decision will be made after one of our providers will assess the patient clinically, work online closely with the hospital to come up with the best treatment plan for that patient. Our other goals are we're trying to limit exposures. Sometimes we'll have just maybe one provider with the patient initially. We're limiting the number of responders to just one ambulance and possibly the supervisor if needed. In collaboration with the Danville Fire Department, we're working closely with them and have decided to limit their response to respiratory runs to prevent exposure and further transmission of the COVID-19 virus. If you call 911, it's important that you're able to answer all the dispatchers' questions appropriately because that will guide how we respond and treat your situation individually. Some takeaways from today is that I know these are very unsettling times, but your emergency system is ready here in Boyle County. We continue to meet weekly with all the community stakeholders. We just ask that you use some basic common sense, social distancing, using straight lines, going to work and coming straight home, or going to the supermarket, coming straight home. Avoid large gatherings of people, wash your hands, and help us protect our most vulnerable in our community. Lastly, I would like to thank all the first responders, personally, EMS, the fire department, our 911 dispatchers, and all healthcare professionals. Thank you.
Now we'll have Ephraim McDowell, representatives, come up and speak to us.
Hello, I'm Dr. Eric Durant. I'm the director for the emergency department and the medical director for Boyle County Emergency Medical Services. Really what I'm here to tell the public is that we're here, we're ready, we're equipped. If you need treatment for COVID-19, Ephraim McDowell Health, Boyle County EMS, and all emergency services are ready to respond. What I would ask, and you may have seen a lot of this already in the public, is in our typical treatment measures, you know, we really have functioned as a service industry. Right now we're more in a mitigation phase. And so what we're really asking the public to do is try to limit use of emergency services to true emergencies. Ephraim McDowell Health is going to be setting up extended clinic hours in other clinics so that we can divert non-emergent patients to those areas. And we are taking other measures to make sure that our essential frontline personnel, such as emergency physicians, ICU physicians, emergency nurses, and our ancillary staff is safe and protected so that we can care for the sick. So again, I would ask that you really think about, you know, your current situation. If it is an emergency, we are here, we're ready, we will take care of you. And I would like the public also to know there's going to be some changes at the hospital. And I'd bring Jason Dean with infection control forward, and he will speak to some of those changes.
Thank you, Dr. Grant. So with the hospital, as soon as March 6th came around and the sheriff declared a state of emergency, we immediately put in precautions and limitation of visitors. The limitation of visitors, what we put in place is one person only per patient at a time. So that means that if you're visiting your loved one, nobody else should be in that room, nobody else should be in the hospital or in the lobbies. If that person leaves, then somebody else can come in and see that person. With our newborns and new mothers, we are allowing just one caretaker or one person overnight to be with that person. We are limiting anybody over the age of 80, anybody under the age of 12, any immunocompromised person coming in. We should be not having those patients or persons or any visitors coming in that's immunocompromised. At McDowell Place of Danville, we have limited at first all visitors to coming in. The only visitors will come to McDowell Place of Danville will be people of end of life. Commonwealth Cancer Center, we've also eliminated anybody coming in unless they're patients. They are immunocompromised patients, so we want to make sure there's nobody, visitors, they can stay in the parking lots, but we don't want them coming in the building. At this time, we have rigorous precautions into place. If a patient comes in, we are doing what Mike said. We're doing one-to-one patient contact, patient care, dedicated workers for those patients. We have a regular screening process in place, so any patient that's coming in to registration, to the ER, to our clinics, we are screening them up front. So we're making sure that we do the right precautions. We're getting them masked before they come in. We're trying to meet them out in the parking lots. If you're sick, we want you to call before you come in. If you think you have COVID-19, please call and let us know. If you want to meet you in the parking lots, we do the right precautions for our staff and for you. And at this time, I'll turn it over to Trina.
Thank you, Jason. So my name is Trina Clarkson. I'm the Emergency Department Director at Ephraim McDowell Regional Medical Center. I'm also their Emergency Preparedness Coordinator. At Ephraim McDowell Health, we have put in, just this week, have put a lot of things in place that will be happening before Wednesday. At all of our emergency departments, if you arrive in a private vehicle with respiratory symptoms, and make your way to the door, there will be a sign posted to return to your vehicle immediately. We will have numbers posted for you to call. At that time, a registered nurse or a paramedic will meet you at your vehicle, assess your healthcare needs, and direct you to where you need to go. All of our respiratory patients that will be coming into the hospital will be taken care of. They will be behind closed door, and they will all be gathered in one spot. We have a part in our emergency department here at the Regional Medical Center that will allow for that. This also is in place at Ephraim McDowell James B. Hagan and also at Ephraim McDowell Fort Logan Hospital. This will go into effect by Wednesday. So that is one change that you will see in our emergency department. The second change that we have made is Ephraim McDowell Health has developed a call center. The number for the public on that call center is 859-936-8350. That's going to be the number that the public can call if you have any questions concerning your healthcare needs or just have any questions about COVID-19 in general. I think that those are probably all of the updates that we have at this time. Please note that our emergency services in Boyle County are here for you, and we are ready, and we will overcome this battle. Thank you.
Okay, again, I just want to reiterate to the president that our entire emergency services operations in Danville and Boyle County, whether it be fire, EMS, police department, and the hospital, we have coordinated efforts. We are ready. If you become ill, we will take care of you. You will receive high quality care, and we will see the public through this. Thank you.
Again, thank you guys. We are truly blessed here in this community to have these people working with us. They prepare for this continually, and they are ready, and we are thankful for that. A couple of things I'm going to give you from the public health perspective. You will have heard some of these before, but it's always good to be reminded of them. One is when you go to all these websites that you're hearing about, you will also see the Kentucky state website. It's the KY COVID-19. That has a lot of great information. We try to push people to that. There's also a 1-800 number there in addition to the other numbers you've heard this morning that you can also call to get guidance on that. The key things that you've heard from a lot of agencies and you will continue to hear from us. Social distancing right now is the key. 6 feet away. Here's a good guide because probably none of us are going to carry a stick around and say you're 6 feet. Stick your arm out, back up a couple of more feet, and you're probably 6 feet away from somebody. That is so important right now as we are stopping the progress of this virus. Wash your hands frequently. Do it a lot. Soap and water. If you don't have that, use sanitizer. That is definitely a part of this. And if you're sick, stay home. Just stay home. I would hope that employers right now are willing to work with people, and I feel like they are, that they're willing to work with people who have that need to just stay home. That's key right now. Okay, let's talk about testing for just a second, because that is a question a lot of people ask. Right now, the way the testing works is most of that has been done through our Ephraim McDowell system in conjunction with the state of Kentucky. Those tests go back up to the state lab, and usually within 24 hours we have a result on that. We have had tests already from this community and surrounding communities, and that will continue. As the testing grows with the commercial labs, that testing will increase. We're not there yet quite, but we are getting there. So right now it's still through that identified process that we were doing. What happens when a case comes back positive? Here's how that works in this community and every other community. From the health department perspective, we then get a case list, and we start talking to people who have had close contact with the person that was identified as being positive. We start looking at places they've been, people they've been around, and then we start trying to see, do we need to have people that need to socially isolate themselves, be quarantined for a period of time to protect the rest of the population? Or how does that need to work? Do they just need to look for signs or symptoms? That is kind of how the testing works. It takes a long time to do those lists. It takes a process of a lot of people to get through that, but we will get through that, and that's how it works. You know, as this thing spreads, it would be great if we could say if a case ended up here in Boyle County, but I usually look at it as when, as every community in Kentucky is probably doing that right now, and this is how we will respond. Some quick things about when to go to the doctor. If you would have not gone to the doctor before because you were sick and you were just stayed home, do the same thing now. If you think that this is more than just an illness that you might need to talk to somebody, call your provider. Talk to them on the phone first. And by all means, as you heard Ephraim talking about, don't show up at the ER unless it's truly one of those emergencies you need to be there, but give them a call on their number first and let them help talk to you on the phone to see where we're going with that. A couple of things just for businesses, and I appreciate the Chamber and EDP being here to talk. Here's what I would suggest in the future. If this is somewhat of the new norm as we're dealing with some different things, go ahead and start thinking about that when the governor lifts his recommendations, whenever that is, it's not happening now, but whenever, how can we get back to business using the things we're learning now and get the economy going again and get people back to work? So go ahead and start thinking about that because that day will come and we need to be ready to do that. I certainly appreciate the amount of people that are in this room that have talked today, that are working together. Again, we truly have a great collaboration here with the state, the city, the county, all of our EMS, all of our Ephraim systems, everybody, our police, everybody, Mike Wilder with EM. We appreciate the collaboration that's been going on. We'll continue to just move right ahead, walk through this with everybody else in the community. And certainly, as you have questions, make sure you catch up with any of us. We'll be glad to answer those as we can. Mike? Oh, one more thing. Here's probably my last little tagline. Stay clean, stay calm, stay clean, and stay cooperative, because it'll take all that as we go through this.
Thank you, Brent. Brent and I have been working very closely together. This situation's team effort. No one person's in charge. Everybody's involved, and we're going to get through it. It's just that simple. It too will pass. That's an old saying. Just to reiterate, I hope the information that's been given here today has been helpful to people. As Brent said, anybody that has any questions, feel free to get in touch with my office, the health department, anybody you need to get into. We will activate an emergency operations center when the situation warrants. We're ready to go. We can do it in a matter of minutes if it has to be. So just remember that. And with that, we're going to conclude the briefing. And again, thank all the partners and stakeholders for being here. It's been a pleasure. Thank you.